We'll talk about how smoking can cause cancer of the nearly every single part of the body and how can it affect your sexual/reproductive health, how can it make you literally blind and make your bones such weak that you might break one just like this. So let's learn how does smoking affects your body. When you start smoking, with each inhalation you take more than 5,000 different chemical substances. Starting from your mouth, the tar in the smoke will stain your teeth, later on decaying the enamel, possibly forming a cavity. The smoke will also affect your smelling capacity. Smoking will also increase the prevalence of COPD and various lung diseases, including cancer as well. Moving on, the carbon monoxide will replace the oxygen in the blood with itself, causing lack of oxygen, leading to one of the major symptoms, that is SOB or shortness of breath. But the major culprit here is the nicotine. It acts on the brain, releasing dopamine, endorphins like feel-good neurotransmitters, which makes it highly addictive, and simultaneously acting on the blood vessels, causing them to constrict and also destroys the tissues of the blood vessels over time. It promotes cholesterol as well as darkening and thickening of the blood, and both of the symptoms will lead you to cardiac arrest or cardiac diseases, and the other health conditions like immunocompromisation or like damaging of the immune system, which will make you susceptible to the every single disease possible in this planet. Smoking restricts blood flow to the skin, hence destroying the collagen fiber in the skin, resulting in premature aging, dull skin tone, eye bags under the eyes, including hair loss as well. Okay, now let's talk about the 4 specific topics of the video. How smoking can make you blind, how can it make your bones like carrots. We all know smoking causes cancer, but how? So the third point is, how does smoking causes cancer? And last but not the least, and the fourth point is, how can it affect your reproductive/sexual/children's health? Okay, starting from the smoking induced blindness, there are 4 points. Number 1 is macular degeneration. For context, this is retina, and very central 5% area is called macula. We use the macula for good sharp vision, for reading, driving or to focus. The remaining 95% of the retina is our peripheral field of vision. So as we know, smoking causes lack of oxygenation and higher amount of carboxyhemoglobin. So the blood supply of the macula gets impaired, causing macula to degenerate. Okay, number 2 is it affects rods and cone cells of the retina, which are the actual photoreceptor cells of the retina. Number 3, a team of researchers from National Institute of Health, USA, have held studies for more than 20 years in how to keep macula healthy and have isolated 6 key nutrients for the macula, and those are vitamin C, vitamin E, zinc, copper, lutein and zeaxanthin, and they are crucial to the eye health. And guess what happens with smoking? The absorption of 3 of the 6 nutrients is impaired or inhibited. And the fourth point is that smoking can double the chance of getting cataract, clouding of lens, sensitivity to light, muted colors, because smoking alters the cells of the lens over time, making it opaque in nature. Okay, the next topic is how come that smoking can make your bones weak. So as we already know, smoking affects the cardiovascular system or the blood supply to the different parts of the body, hence also to the bone tissues, resulting in the less absorption of the nutrients in the bone. But majorly the culprit here also is nicotine. Nicotine affects the osteoblast or the bone producing cells, and hence also can cause osteoporosis. Okay, the next point is how does smoking causes cancer. But before we know about how does smoking causes cancer, we should know about what is cancer. So in the nucleus of the cell, there is something called DNA, and they contain information and determine the activity of the cell. But when DNA goes some destruction or mutation, it can lose its true information and can start multiplying uncontrollably, and most importantly not in its true nature. And that is what we call cancer. Okay, now smoking not only destroys or mutates the DNA, causing various types of cancer, it also prevents repairing them. To be exact, it can cause lung cancer, mouth cancer, throat cancer, sinus cancer, and these many cancers. And finally, how come that smoking can affect your sexual or reproductive health? Okay, ladies first, this is how smoking affects your reproductive health. You don't have to be a smoker. If your partner is a smoker or anyone near you is smoking, that can also affect you as a secondary smoking. In that condition, the breakdown products such as nicotine can be found in the follicular fluid of women. And if you are a lady smoker, then your eggs are totally soaking 24 hours a day, 7 days a week in cigarette smoke breakdown products. And the other important points are, it can result in premature loss of ova or egg. Smoking can cause the higher level of affets. The higher the level, the lesser the eggs are made. And in such case of active or secondary smoking, IVF can be also very difficult to undergo successful. And even after all these conditions, even if you get pregnant, smoking will affect your baby's brain, the lung development, and also some studies have shown the relation between mother's smoking and cleft lip. And in these conditions, my suggestion will be, well, first of all, yeah, not to smoke and avoid also secondary smoking. And if you live in a polluted city, so you can invest in air purifier at home or wear mask when you go outside. Okay, now let's talk about men, and pardon my voice, and yes, I have got flu because I also live in a polluted city. And talking about the men, you know what, there is a not very good evidence that smoking affects the sperm count or saber size of the sperms or the semen production in men. But later what we found in the research is the smoking affects the DNA inside the sperm cell. Okay, for context, sperm cells basically carry every single bit of your information in form of DNA or a genetic component, and that's what sperm cells are built for carrying the man's DNA to the ova or the egg for creation of a new life. And when we look at the DNA quality of the smokers, the DNA is more likely to be chopped, damaged or disorganized. And this type of damaged DNA cell containing sperm is less likely to impregnate the egg or more likely to be a miscarriage. And even if the impregnation happens, the child or the kid is more likely to be suffering from some kind of syndrome. And last but not the least, or the cherry on top of the cake, is smoking can affect your erectile function, or saying directly, it can cause erectile dysfunction. So you better don't smoke. So as a health professional, my practical advice to the smokers will be trying to avoid smoking or quitting smoke before 3 months when you're trying to conceive a baby. And after that, it is very reasonable to quit smoking, because if you continue, then all the harmful effects that your partner and your child are getting is upon your shoulders. So after all this, if you want to quit smoking, then please consult your nearest doctors. There are many alternative ways to quit smoking nowadays. Hey guys, I'm on the mission to make this world disease free. I know it's a very big mission on the start, but it's all about ambitions, right? So join me in the mission by subscribing to the channel, and let's make the world healthy. Thanks for watching.